Hello, this is Bill Malm with Vitalware on our introducing our lightning round presentation on Midland Health, a Vitalware case study. Today I'm with Laura Stapleton from Midland
Good morning.
and Rhonda Lupardis also from Midland.
Hello.
We're going to start today with a little bit of the background on Midland Memorial. Their goal is to make quality healthcare available to all the residents in Midland County. They were started off in 1950 as a 75-bed hospital serving 22,000 people in Midland County in Texas. Over the decades, Midland's expanded to reach its versatility and meet the needs of the growing dynamic community. Has 2 different locations, around 500 beds, and their aim is to make Midland community the healthiest in all Texas. They have focused on mid-revenue cycle efficiency, and their goal and why they partnered with Vitalware was to find a root cause solution to multi-cause revenue integrity issues. All revenue integrity issues tend to be more complex these days. Improve revenue integrity and charge capture processes. Reintroduce rebilling and claim rejections to reduce billing and claim rejections to get them down where they're manageable and be more active and efficient with pre-bill analysis. And Rhonda, you want to tell us your favorite quote?
My biggest challenge, charge capture all day long.
And that's pretty much what we've seen from Midland. They're all focused on charge capture. Previously, they had EMS provider, CDM provider, and revenue integrity team, but they've moved their entire platform to the Vitalware platform. Their EMS provider, they have CDM, knowledge, analysis, and our entire Vitalware team is part of their partnership now. So in order to do the smooth transition, they wanted to pick a right team, process, tools, and views to get all the data to be able to do it. And Rhonda talked to us about implementation, and she stated that one of the implementations, this was the smoothest yet, because of the ease of use. It was user-friendly, understand what you're looking at, and it doesn't require a master's degree, which we thought was great because it doesn't require a master's degree. It's straightforward and user-friendly. Support, Rhonda, why don't you tell us about our support here?
I can't say enough about the support team. They're always available. I can shoot an email or just pick up the phone, and they're always available. And that's what's made the ease of implementation go so well.
And with that, why don't you talk about how you had to customize it to meet your requirements?
We were looking for a pre-bill solution so that to increase our clean claim rate, we were 2 years into a new financial system and looking for ways to improve it. And so we customized our vital analysis to pull in claims pre-bill before the clearinghouse sends them out to cut down on rebills. And we were able to do that in just a few weeks.
Thank you, Rhonda. So their keys to a sustained approach was a team approach. Readily accessible experts at Vitalware. All of our team has significant consulting and mid-revenue cycle experience. I won't even get into my age, but the team itself has over 110 years of Vitalware rev cycle experience. And so they were able to work with us and get all their questions answered. We do have our weekly call, which is great, with their personnel to look at what exactly is going on. Is it a denial? Is it coming from a department? Is it their charge master? So the availability and timeliness of both of our teams made this combined effort to be a very big success. So the comprehensive solution that they've chosen is a single platform solution, which includes their charge master, regulatory vital knowledge, and all coding questions are in there, vital analysis, which is their charge capture. And they consume 100% of their charge and claims data every single day and provide the context. So they're not missing a single charge 100% of the time. And that enabled Midland to get to their root cause. So recently they stated they started with their low-hanging fruit, but now we're past the low-hanging fruit. We're into those more complex issues, charge capture issues, physician preference issues, and so we're going into multi-cause issues. So it's comprehensive, and as Rhonda says, it lets her go where she needs to go. So under self-sufficiency, Rhonda and Laura, why don't you talk to us about the better edits, data, and pre-bill analysis?
Well, we've increased, we've suppressed rules that don't really apply to our facility or our state per se, but the clearinghouse only gives us basic coding error edits, not errors, basic coding edits, and vital analysis will actually link that up. If you've got this catheter, where's your procedure? And that has helped so much in also just catching things like transposed HCC. We found several of those, and I refer to that as the low-hanging fruit. But it's just gotten better every week. Adding the triggers and the targets to the view has helped tremendously. I just can't say enough about it.
Thank you, Rhonda. So one of the big Vitalware slogans is your rules, your view, your way. And doing it their way, they used to have solutions that worked well for them, but they had to adapt their processes to the solution, not the solution to them. So at Vitalware Suite enabled them to really tune their process, because once we implemented, we asked them how they do their business and amended vital analysis to ensure it met their requirements, including taking it from a post-bill environment to a pre-bill environment that allowed them to catch things sooner and prevent those rebills. So they're looking at what's happening so they can build those complete remediation. And again, their sole goal was root cause identification and remediation to ensure a clean claim. So if you look at their first month scorecard, they identified about $1.5 million in growth and got 308,000 in net. And when we look at their cumulative, which is 2 months, they got almost 3 million in identified growth and cumulative net. And we start to see the rule triggers are starting to go down because they're catching them more and more every day, and we're fixing them. So the whole goal is root cause remediation. We would be extremely happy if no triggers went off at all on every single day. That means they're getting 100% of their claims, no charge leakage, and before they get started. So with that, I'd like to ask Rhonda and Laura for any last minute comments.
As I've said, I'm very pleased with the product. It's given me a 360 view of our charges, and as we improve with the use and learn all of the capabilities, I only expect it to get better.
Yes, and I've just really enjoyed how much it's helped my team in charge services and the ease of use that it's given them.
Well, thank you for joining us today, and the group at NARI. It's been our pleasure to be able to present this case study to you. Have a great day.
Thank you.
Thank you.